And now we are going to next agenda item on health emergency preparedness response and the resilience in the WHO European region 2024-2029. So for this item, the relevant documents are displayed on the screen. So following the WHO Regional Committee for Europe at its 72nd session in 2022, the WHO Regional Office for Europe has launched a consultation process with member states on developing the Preparedness 2.0 strategy and action plan on health emergency preparedness response and the resilience in WHO region, European region. In addition to strengthen the health emergency preparedness, response and resilience at the regional and national levels, the WHO Regional Office for Europe is launching a member state consultation process to develop a new regional action plan for strengthening the emergency medical teams initiative in our region. To share more about these developments, I would now like to invite Dr. Gerald Rockenshaupt, Regional Emergency Director, to take the floor. So over to you, Gerald.
Thank you very much, Honorable Chair Dr. Mara Charanov. Honorable delegates, some of you might well pose the question, why Preparedness 2.0 and why now and why a regional process on top of the ongoing processes at the global level? Well, I think we are no longer in Europe a region free of emergencies, and I think the increasing number of ongoing crises, of newly evolving crises and disasters speak very loud and clear that we need more and consolidated and renewed efforts to strengthen preparedness and resilience. We are still suffering collectively from the impact of the Ukraine war. Since February 24th, we see massive civilian displacement and casualties, targeting of civilian infrastructure and health facilities, and challenges with access to health services, particularly in those areas with active fighting. In February, we woke up to the devastating earthquakes that hit southern Turkey, affecting not only southeast Turkey, but also parts of Syria, with over 45,000 deaths in Turkey and more than 107,000 injured. We saw an unprecedented level of international solidarity, with 42 international emergency medical teams deployed to work side by side with the UMKE Turkey teams, with the health professionals to treat the wounded and to provide primary care services. And we also scaled up our cross-border support into northwest Syria through our Gaziantep hub based in southern Turkey. More recently, we saw an emergency unfolding in Armenia with massive movement of displaced people into Armenia, and WHO mobilized support to support the Ministry of Health-led response, again with deployment of emergency medical teams to meet the massive challenges through a compounded additional event, an incident that was triggered by an explosion of a gas station with over 200 deaths and more than 300 severely injured burns victims. Now we have a focus on providing mental health and psychosocial support, and our local teams work hand in hand with the Ministry of Health. And we are all obviously shocked by the recent unfolding drastic situation in Israel, with extensive human suffering in Israel and in the occupied Palestinian territory, with civilian deaths and injuries in Israel and in the occupied Palestinian territory in the Gaza Strip, with documented attacks on healthcare, with hostages still in Gaza held in captivity, and with the possibility of a regional conflict that could further unfold there. And we are still, as region, transitioning out of the emergency phase of the global COVID-19 pandemic and of the Mpox global emergency. We, at the regional level, are proposing a strategic shift towards a more programmatic approach in our COVID work, emphasizing on sustaining the gains made during the consolidated investments and the strengthened health systems capacity that we have now, with an emphasis on protecting the vulnerable. Just yesterday, ECDC and WHO Europe launched a new platform to share and track real-time data on respiratory viruses. And I would like to thank the director, Dr. Andrea Amon from ECDC, for this continued and very productive collaboration. On the Mpox side, a success story that I think was also highlighted by our regional director on the first day. We are now shifting to provide a framework for member states to develop national 5-year action plans towards control and elimination of Mpox, with a very strong focus and advocacy for sustained inclusion and empowerment of affected communities. Preparedness 2.0 is really all about closing the gaps while ensuring alignment with global processes. We foresee strengthened country preparedness and readiness based on the collective lessons learned from the COVID pandemic through an all hazards approach and a One Health approach. We also want to accelerate the implementation of the Monti Commission recommendations, including the operationalization of the Pan-European Network for Disease Control. We want an emphasis on building a flexible and agile health emergencies workforce, including through expanding the capacities, the regional capacities of emergency medical teams, strengthen the country capacities and build resilience to manage the dual-track approach, responding to emergencies while sustaining essential services, building trust through risk communication, community engagement, and infodemic management, and institutionalizing a gender perspective with the prevention of any form of sexual misconduct in emergency contexts. A key pillar is the Emergency Medical Teams Initiative, and we are building a regional health emergency core as a key pillar for Preparedness 2.0, based on transparent governance, a regional European EMT capabilities hub, REACH, to be established in Istanbul in close collaboration with our GDO there, and with a strong emphasis on digitalization, with the target to develop a regional EMT action plan by 2030. What we are proposing, dear delegates, is a process built around consultations. We really want to build this collectively, including the member states' perspective strongly aligned with the global processes, the INB negotiations, the working group of the IHR, and the DG's 10 proposals for a strengthened global architecture for health emergency preparedness, response, and resilience. The process is all about co-creation of priorities based on the inputs from you, our member states. It is our collective responsibility to move forward on preparedness and to build a resilient region. We are very lucky to have a strong partner in that respect. We have convened a very decent and senior group of technical experts with our technical advisory group that will accompany and help us in developing this process together. We obviously ask for your support to take this process further forward and to then submit a collectively developed strategy and action plan to the next Regional Committee 74. Thank you very much.
Thank you very much, Dr. Orkenshaupt, for this very valuable information. And now I would like to give the floor to Dr. Gail Carlson, Chair of the Technical Advisory Group on Preparedness 2.0, who has kindly joined us for this session and who will provide an update on a group's recent activities and reported reported in the relevant information documents. So, Dr. Carson, you have the floor.
Thank you, Chair. Thank you, Gerald, and of course, thank you, Regional Director. And I'd like to thank Eo and his team who's sitting with me up here. It's a pleasure to be here today representing my colleagues on the Technical Advisory Group at the start of this journey that I'm hoping you are going to come on with us. Perhaps my slide could come up, if that's possible. While that's happening, I'd like to invite you to do something for me before I go into the slide. I'd like you to sit back and imagine, paint in your head, what preparedness, what successful preparedness would look like for your country, your population. It might be a painting, it might be a sketch, it might be a digital drawing, it might be a video. You're coming up with so many ideas at the moment. Hold that thought, please, because thoughts determine words and words determine action. And over the next year, we're going to need to see an awful lot of action collectively. The Technical Advisory Group here will play a role in this, but we really need to work in partnership with yourselves and with your colleagues. And we're doing this on behalf of WHO Euro. It's going to be a tough year, but for all the reasons we've heard, we have to deliver. So the next two slides are just headlines, you know, a word of reassurance. This work is not done, it's just about to start. We've only had one face-to-face meeting so far and one virtual meeting. The TAG will meet face-to-face in November, and thank you to the members of the SCRC who have joined us so far on the early stages of this journey. So reassurance, no duplication. We are not dismissing the importance of all the wonderful efforts, documents and resolutions that are already in place or are in progress. Somehow or other, with you, Preparedness 2.0 will try to make sense of all of that context, so we can help you at the country level and with the WHO country offices navigate through the space so that we can try and do the best for our populations. We will, and already have, during our discussions, recognise the importance of this all-hazard approach and a One Health approach. These are terms that many of you understand and we've heard in the previous session on AMR. But we have to start to get down to operationally, what does that actually mean in terms of preparedness? We have looked at one of the newer WHO initiatives called the HEPR, around health emergency preparedness, response and resilience, and I realise that some of you will be more familiar with this than others, and we will take you through that journey as we try to operationalise that. And actually, in the COVID-19 transition plan for your region, that document already does that and builds off what's called the 5 C's within that. And one of those C's is collaborative surveillance, which I'm sure we'd all agree is absolutely central to preparedness. During the COVID-19 pandemic and also the Mpox epidemic, I think we now all truly acknowledge the importance that communities play in an effective response. They should be equally held centrally and engaged going forward. I think in some countries this may be easier to do than others, but it's wonderful to hear the importance that you've put on primary health care during this meeting, and that should obviously include the community health workers. The TAG was quite shocked at the disparity of the access to COVID-19 countermeasures across the European region, and therefore we certainly want to consider how can equity and access be at the heart of preparedness going forward. These are very broad statements, and we understand that underneath this, there's an awful lot of work to do. And without a doubt, strong healthcare systems. I'm a hospital clinician by background, and my heart will always lie with my colleagues in the health workforce. We have to consider strengthening our health systems, and I know that you already are. But there is much more to do. We have to deliver on that dual track. We have to ensure the resilience is there to deal with the cardiovascular disease, to deal with the diabetes and so on, during whatever health emergency will hit us. You, the ministries, the representatives of the ministries, have to be at the heart of that and be working closely, as you do, hence probably why you're here, with your public health colleagues. But take the workforce with you. We have to all have our listening ears on, as my son's primary school teacher would say. I'm delighted to see and hear that yesterday was dedicated to governance. Some people would consider that's a boring subject, but it's actually, again, at the heart of defining the framework of how we deliver this going forward. So we look forward to working with all of you. I look forward to seeing you back here in a year where hopefully we can be proud together on what we managed to come up with and then look forward to delivering it through the action plan. Thank you very much.
Thank you very much, Dr. Carson, for this important information. Finally, I would like to give the floor to Mr. Gina Claes, Head of the Department, Crisis Management, Federal Public Service, Health, Food Chain Safety and Environment on behalf of the Regional Chairmanship Group of the EMT Initiative of the WHO European Region. So, Mr. Claes, you have the floor.
Thank you very much. Distinguished Regional Director, Honorable Ministers, Your Excellencies, and respected colleagues. Let me express my sincere gratitude for the invitation to speak on behalf of the Regional Chairmanship Group for the Emergency Medical Teams initiative in the WHO European region. Our chairmanship group consists of EMT national focal points from Germany, Norway, and Belgium, and represents 63 emergency medical teams across the region. As mentioned by so many at this regional committee, in recent years we have hit relentlessly by a full spectrum of public health emergencies. 4 years of COVID-19 response and recovery has transformed our global and regional perception of our public health preparedness and resilience. Not to mention the health impacts caused by climate crisis, natural hazards like earthquakes and floods, and armed conflicts. These humanitarian disasters have demonstrated the need to further develop and sustain the preparedness, response, and resilience of health systems, and the need to adopt a proactive approach with advanced planning for such capacity. When WHO established the Emergency Medical Teams initiative, the overarching goal was to ensure a global health workforce that is rapidly deployable to emergencies and operating with common guiding principles, standards, and methodology. 14 years later, our focus has shifted and expanded from deployment alone to the building of national and subnational EMTs, search planning and coordination to strengthen and support health systems. The Global EMT 2030 strategy was launched at the 2022 EMT Global meeting in Armenia, laying out the longer-term direction and priorities of the EMT initiative to be adapted and integrated by the regions. Distinguished colleagues, in order to recognize our diversity as a region and cater to our regional community of practice, partnerships, context our communities in need and our collective well-being. I take this opportunity today to make a call for the development of a WHO regional action plan to strengthen the emergency medical teams initiative in the WHO European region by 2030, to be presented at the 74th Regional Committee in 2024. As shared by our esteemed Regional Director, we have made great progress in key areas of work, setting the foundation for the building blocks of the action plan: governance, capacity building, and digitalization. This includes a reformed and diverse governance structure, Governance 2.0, grounded in representation and inclusivity and drawing from the collective experience of WHO member states and experts. Expanding capacity building activities with the launch of the Regional European EMT Capabilities Hub, REACH, in Istanbul, a resource that will only further hone our skills and exchange of knowledge and crucial lessons learned. And last but not least, digitalization of preparedness and response through the Knowledge and Information Management Emergency Platform, KEMAP. The future of health emergency response is digital. With KEMAP, we can take steps forward to map the capabilities that exist, but also to detect possible gaps. As a member of the current regional chairmanship group of the EMT European Regional Group, I can attest that we are well poised to take the next steps together and further our progress. We wholeheartedly support the establishment of a technical working group and launch of a region-wide consultation with member states, EMT national focal points, and partners to develop a regional action plan on the basis of the Global EMT Strategy 2030, designed to strengthen the integration of EMT response and coordination capacities in national health structures. In conclusion, we at the Regional Chairmanship Group, we ask for commitment and support from member states to start this process so that the EMT initiative is optimized in every country in the WHO European region. Please help us save some more lives, and thank you for your attention.
Thank you very much, Dr. Claes, for this very important information. And now I would like to open the floor for any comments and remarks from the member states. So, Spain, you have the floor, following by Croatia. Please.
Thank you. Honorable Chair, distinguished delegates, Spain delivers this statement on behalf of the EU and its member states. First, let me salute the sustained efforts of WHO Euro in bringing life-saving assistance to the people in Ukraine and refugees in neighboring countries faced with the tragic consequences of Russia's war aggression against Ukraine. WHO is now facing two more major emergencies in the region. The European Union condemns in the strongest possible terms Hamas and its indiscriminate terrorist attacks across Israel and deeply deplores the loss of lives. We strongly emphasize Israel's right to defend itself in line with humanitarian and international law in the face of such violent and indiscriminate attacks. We reiterate the importance to ensure the protection of all civilians at all times in line with international humanitarian law and the importance of the provision of urgent humanitarian aid. We stand ready to continue supporting those civilians most in need in Gaza in coordination with partners, ensuring that such assistance is not abused by terrorist organizations. It is vitally important to provide urgent humanitarian aid to all those civilians who are in dire need of water, electricity, food, and medicine. The EU continues to follow with concern the devastating situation arising from the mass exodus of Armenians from Nagorno-Karabakh following Azerbaijan's military occupation on September 19th and 20th, and the month-long blockade on the Lashin corridor. As of today, more than 100,600 people, amounting to nearly the entire population of Nagorno-Karabakh, have found refuge in Armenia. It is imperative to ensure continuous and independent humanitarian support to those who are still in need in Nagorno-Karabakh, as well as to those who have left. We appreciate the speedy decision taken by the regional director to assist those in need with special health conditions and to send the special envoy of the regional director to Armenia to assist in coordinating life-saving assistance for those fleeing the conflict. We also highly welcome WHO Euro engagement with nature and climate-related hazards that have been particularly devastating in 2023. WHO responses to the deadly earthquakes in Turkey and Syria have once again demonstrated WHO's commitment and efficiency in emergencies triggered by natural hazards. In particular, regarding immediate life-saving assistance, the quick deployment of medical teams, and the focus on mental health issues that affected thousands of people in the aftermath of the disasters. Regarding the work towards the Preparedness 2.0 strategy and action plan on strengthening health emergency preparedness response and resilience in the region, firstly, we commend WHO for acting as a global thought leader on preparedness by presenting this concept of Preparedness 2.0. We fully support the dual approach, aimed at strengthening health systems to enable them to maintain essential health services while effectively managing health emergencies. We applaud the intention of revisiting the ambition on the emergency medical teams strategy and scaling up this ambition. And we welcome the establishment of the Pan-European Network for Disease Control as a flagship action to the Preparedness 2.0 strategy. Currently, the EU has strengthened its health security framework through the adoption of a strong legislative package which includes the strengthening of the mandates of the European Medicines Agency and the European Centre for Disease Prevention and Control, the ECDC. The adoption of the new regulation on serious cross-border threats to health, as well as the creation of the European Health Emergency Preparedness and Response Authority, HERA, the member states' level of implementation of the EU member national prevention, preparedness and response plans will be assessed, and the ECDC is currently developing standards and criteria in this regard. In this context, we welcome the close coordination on this issue between WHO and the European Union. A pan-European approach to health emergency prevention, preparedness and response should also benefit from the expertise and experience present in the EU to avoid duplication and ensure synergies through a strong collaboration with the EU and its agencies and institutions, and in particular, the European Centre for Disease Prevention and Control and the Health Emergency Response Authority, whose roles are relevant at EU, pan-European and global levels. Secondly, it is paramount to ensure that Preparedness 2.0 is articulated within the broader global context, in particular with ongoing work on the amendments on the IHR and the development of the Pandemic Accord. We also encourage strong relationship with key WHO institutions in the European region, such as the WHO Liaison Office for Health Security, the WHO Academy...
Excuse me, Spain, may I ask you to finalize your statement, please?
Almost finishing, thank you. WHO Academy with regards to training and the Open Hub of Pandemic and Epidemic Intelligence in Berlin. Finally, it is crucial that the strategy also addresses EU key priorities such as cross-border collaboration, digital health technologies, human resource challenges, as discussed this morning, reaching the most vulnerable, and the One Health approach. We welcome the work done by the WHO already and look forward to discussing the strategy further. Thank you very much.
Thank you very much, Spain. As I know that there were another group statement. As you know, we first go to the group statements and then to the individual statements. So next, I would like to give the floor to Croatia for the group statement.
Honorable Chair, distinguished Regional Director, Excellencies, colleagues, please allow us this opportunity to inform you of an initiative to be presented at the upcoming 77th World Health Assembly in May next year. It gives us a great pleasure to announce that Croatia, Fiji, and Mozambique, as a core proponents, together with a cross-regional core group of countries, namely Australia, Bangladesh, Costa Rica, France, Germany, India, Italy, Ireland, Nepal, Monaco, Pakistan, Slovakia, Slovenia, Samoa, Tanzania, Turkey, and the United States of America will be presenting a resolution on strengthening health emergency preparedness for disasters resulting from natural hazards at the 77th Assembly. Excellencies, there is no time like the present to take urgent action in strengthening our health emergency preparedness for disasters resulting from natural hazards. Natural hazards, exacerbated by climate change, continue to pose significant threats to global health and well-being. The COVID-19 pandemic, the recent devastation caused by natural disasters such as earthquakes, tropical cyclones, droughts, heat waves, wildfires, and more, continue to show us undeniable escalation in frequency and intensity and its harm to human life. It is against this backdrop and through our shared vision and priority to plan and prepare for the impacts of disease outbreaks in combination with disasters resulting from natural hazards that this resolution is being proposed for the 77th World Health Assembly. Excellencies, the resolution seeks to renew commitments, advance the high-level strategic dialogue, and maintain political and financial commitment and support for this priority area. The resolution aims to enhance risk reduction, mitigation, and health system resilience with a focus on marginalized and vulnerable populations. It also emphasizes coordination, capacity building, and the provision of essential health services during and after emergencies. The resolution requests WHO to develop a global framework and supporting tools to strengthen emergency preparedness for disasters resulting from natural hazards, whilst addressing context-specific approaches for vulnerable settings. The aim is to strengthen health emergency preparedness for disasters resulting from natural hazards. The resolution recognizes the interconnectedness of health and disaster risk reduction and emphasizes the role of all stakeholders in safeguarding the health and well-being of communities worldwide. Excellencies, the last dedicated resolution that put particular emphasis on this priority area was Resolution WJ 64.10 on strengthening national health emergency and disaster management capacities and resilience of health systems, which was adopted by 64th World Health Assembly in 2011. It has been over a decade since, yet the strengthening of our health systems preparedness for disasters resulting from natural hazards continue to fall behind. Therefore, the proposed resolution builds upon international commitments and existing resolutions and initiatives, recognizing the multidimensional aspects of disasters and the importance of whole of society engagement. Through coordinated efforts, political commitment, and evidence-based approaches, this resolution seeks to enhance the resilience of health systems and protect populations at risk during times of crisis. Croatia recognized the importance of the proposed resolution, and a cross-government working group was established at the national level, composed of representatives of all parties participating in the strengthening health emergency preparedness for disasters resulting from natural hazards, in order to assist in the preparation and implementation of the proposed measures and activities agreed upon in the resolution. So, finally, Excellencies, the diverse and cross-regional core group has been working hard over the past months to finalize the zero draft of the resolution and stands ready to head into the second negotiations in the coming weeks as we begin our preparations for the Assembly early next year. We would be remiss if we did not take this opportunity now at this regional forum to inform you of this important initiative and to seek your support and partnership in the core group as we head into the next World Health Assembly. Thank you.
Thank you very much, Croatia. We also now have another group statement on behalf of the Nordic and Baltic countries. I would like to invite Norway. Please, you have the floor.
Thank you, Chair. I make this statement on behalf of the Nordic and Baltic countries, Denmark, Estonia, Finland, Iceland, Latvia, Lithuania, Norway, and Sweden. We agree that there should be a health emergency strategy in the region, and we look forward to following the further development of the text. We thank the regional office for including support to member states in ensuring that national health sector agencies have the appropriate role within the national context in developing national preparedness plans and in developing national capacities. Given the wide impact of health emergencies on societies, these plans and capacities must be comprehensive and multi-sectoral, taking a whole of government and a whole of society approach. We also especially appreciate the emphasis on enhancing the knowledge base for public health and social measures. On some point, we would like to better understand the regional office thinking. This is especially true for the areas of community protection and coordination, where it is not clear what is intended. We also want to understand better how the pan-European network for disease control would be organized, governed, and financed. In the area of access to countermeasures, it is not clear to us what is envisioned, given that the ongoing INB and IHR processes, as well as the establishment of the interim countermeasures platform, will have implication also at regional level. We would appreciate information on specifically what work is envisioned in this area at regional level. In general, the strategy needs to take into account other ongoing initiatives and avoid duplications. Finally, we support the initiation of a process to develop an EMT strategy for the region. We look forward to taking part in its development. Thank you.
Thank you very much, Norway. And now I would like to give the floor to Belgium, following by the Russian Federation. Belgium, please, you have the floor.
Thank you, Mr. Chair. Belgium fully aligns itself with the statement delivered by Spain on behalf of the EU and member states. We thank the Regional Director for inviting us to prepare a new regional strategy and action plan, Preparedness 2.0. As a starting point, we would like to recall that there was only very little correlation between the scores given by the WHO joint external evaluations to countries on the one side and the actual performance of country during the COVID crisis on the other side. To us, this difference means that we should revisit our concept of preparedness. We do believe that the conceptual framework in the background document provides an important first step in the right direction. For example, we note with satisfaction that this framework puts a specific focus on governance and leadership, community engagement and the role of subnational authorities, prevention of unintended consequences of public health measures, fake news, as well as equitable provision of medical countermeasures. We strongly support the intention of developing a regional action plan for strengthening the emergency medical teams initiative and scaling up its ambition. However, we wish to make 3 comments at this stage. First, we believe that this strategy should not only be based on the lessons we learned from the past, but also the crises we can foresee now already, like climate change and, of course, AMR. Second, the recommendations in the final strategy should be evidence-based, or should at least incorporate high-quality evidence gathering directly from the beginning of a health emergency. And third, this strategy should guide our preparedness planning at national level and also inform our negotiations around the pandemic treaty and the international health regulations. Therefore, we insist on its alignment with emerging global architecture and the links made with other regional initiatives, including at the EU level. We encourage the Secretariat to continue this work and aim for concrete and operational improvements in Member States' preparedness capacities in our region, which are relevant for all countries, independent of their income level. Thank you, Mr. Chair.
Thank you very much, Belgium. Now I give the floor to the Russian Federation, following by Bulgaria. Russian Federation, you have the floor.
Уважаемый председатель, коллеги, Россия вносит существенный вклад в обеспечение готовности и повышение регионального потенциала в реагировании на эпидемии в европейском регионе ВОЗ. За последние 6 лет Россия выделила финансирование на поддержку программ ВОЗ по имплементации ММСП и развитию сети ГУАРН более 16 миллионов долларов. Уникальной является инициатива Российской Федерации по развитию сети мобильных лабораторий быстрого реагирования. На сегодняшний день российские лаборатории широко используются в 14 странах мира. Только за последние несколько лет за рубеж передана 31 такая лаборатория, из них 24 в страны Европейского региона ВОЗ. За последние 3 года нами проведены 14 практических учений команд быстрого реагирования с использованием мобильных лабораторий, в которых приняли участие более 750 специалистов. Совместно с Евробюро ВОЗ Россия разработаны стандарты для мобильных микробиологических лабораторий, которые были отработаны в ходе 2 крупнейших международных учений при участии представителей более 20 стран мира. По вопросу проекта новой региональной стратегии обеспечения готовности 2.0 отмечаем, что представленный на рассмотрение документ требует, по нашему мнению, серьезной проработки, в том числе в рамках консультаций с участием представителей всех стран региона. На данном этапе представленный проект сложно взять за основу для дальнейшей работы, так как он содержит инициативы, термины и стандарты, поддерживаемые не всеми государствами Европейского региона ВОЗ. Прежде всего, это введение систем внешнего мониторинга, а также универсальных обзоров состояния здоровья и готовности. Требуется доработка структуры и включение четкого плана действий. Кроме того, неясны цели и задачи общеевропейской сети по контролю заболеваний как координатора усилий в рамках реализации стратегии. Считаем нецелесообразным экстраполировать в рамках Европейского региона ВОЗ стандарты Евросоюза. Логичным шагом представляется совместная разработка подходов к профилактике и реагированию на инфекционные угрозы. Разработка и согласование документов, имеющих значение для всего региона, должны вестись в духе инклюзивности и транспарентности с активным участием всех стран, с учетом их интересов и возможностей. Готовы со своей стороны принять участие в доработке проекта стратегии. Благодарю за внимание.
Спасибо большое. Thank you very much, Russian Federation. So next, Bulgaria, following by Austria. Bulgaria, you have the floor.
Honorable Chair, distinguished Regional Director, Excellencies, Bulgaria aligns itself with the European Union statement made by Spain on behalf of the Member States. Bulgaria is actively working to strengthen the national regulatory framework for preparedness and response to health emergencies. In accordance with IHR standard operating procedures have also been developed for action in the event of the international health threat. Multi-sectoral collaboration, and particularly the civil-military one, is the key element of regional and global health security. It is not possible for the health sector to tackle cross-border health threats on its own. In this regard, WHO's contribution to the establishment of a national civil-military health collaboration framework for strengthening health emergency preparedness is highly valued. Just 10 days ago, a national seminar was organized in Bulgaria jointly by WHO, HQ, and Regional Office for Europe, the Ministry of Health of Bulgaria, and the Ministry of Defense of Bulgaria. Bulgaria is one of the few countries on global scale to have concluded such an event, targeted at joint multi-sectoral timely actions in critical times. Senior participants from Ministry of Health, Ministry of Defense, and their subordinate structures mapped the existing capacities of both sectors using the recently developed WHO CMAP tool. We jointly explored opportunities for strengthening cross-sectoral cooperation targeted at enhanced national preparedness for coordinated joint action in health emergencies. To conclude, Bulgaria considers health security a major priority and welcomes the initiative of the WHO Regional Office for Europe to strengthen the region's preparedness, response, and resilience through hazard response and One Health approaches, while not duplicating initiatives. The COVID-19 pandemic and the escalating numbers of crises of different nature that affects the lives and health of the population in our region has shown that the need for coordinated strengthening of member states' capacity to collectively respond to health emergencies with the potential for cross-border threats. Bulgaria supports the proposal for strategic priorities in preparedness 2.0 and is actively working on building cross-sectoral capacity for crisis response. Thank you for your attention.
Thank you very much, Bulgaria. Now, Austria, following by Poland. Austria, you have the floor.
Vielen Dank, Herr Exekutivpräsident. Österreich schließt sich der Wortmeldung der EU und ihrer Mitgliedstaaten an. Wir begrüßen die Bemühungen des Regionalbüros zur Bewältigung der umwelt- und klimabedingten Krisen. Diese Krisen unterstreichen die Notwendigkeit einer rechtzeitigen Reaktion auf Notfälle im Bereich der öffentlichen Gesundheit. Auch die Erfahrungen im Zuge der Covid-19-Pandemie haben dies gezeigt. Österreich unterstützt das Konzept Preparedness 2.0 in vollem Umfang und würdigt die Führungsrolle der WHO. Die Stärkung der Gesundheitssysteme für das Krisenmanagement ist von entscheidender Bedeutung. Wir schätzen auch die Zusammenarbeit der WHO mit der Europäischen Union, um Synergien zu erzielen und dadurch die Vorbereitung und Reaktion auf Notfälle zu verbessern. Auf EU-Ebene beteiligt sich Österreich aktiv an den Gesundheitssicherheitsmechanismen, insbesondere durch MEDEVAC. Im Zusammenhang mit Preparedness 2.0 arbeitet Österreich intensiv an einer Akkreditierung der Emergency Medical Teams und finalisiert einen nationalen Pandemieplan, um Reaktionsprotokolle und Ausstiegsstrategien zu definieren. In unserer vernetzten Welt sind Notfälle im Bereich der öffentlichen Gesundheit grenzüberschreitend und erfordern einen ganzheitlichen Ansatz während des gesamten Krisenmanagementzyklus. Das Preparedness 2.0-Konzept stellt einen genauso wichtigen Schritt in diese Richtung dar wie der erfolgreiche Ausgang der aktuellen Verhandlungen zu den Änderungen der internationalen Gesundheitsvorschriften und zur Schaffung eines Pandemieabkommens. In diesem Zusammenhang ist ein starkes Engagement für One Health unerlässlich. So kann die Staatengemeinschaft eine rasche und effiziente Reaktion auf Gesundheitsbedrohungen gewährleisten und sich gleichzeitig gegen künftige Herausforderungen wappnen. Sehr geehrter Herr Exekutivpräsident, wir möchten diese Gelegenheit auch nutzen, um die engagierte Tätigkeit der WHO-Länderbüros in der Ukraine und der Republik Moldau besonders hervorzuheben. Österreich unterstützt dieses unentbehrliche Engagement der WHO-Länderbüros und führt mit ihnen gemeinsam Projekte durch, die zielgerichtet zur Stärkung der Gesundheitssysteme dieser Länder beitragen. Abschließend möchten wir uns als Österreich an dieser Stelle bei Herrn Dr. Rockenschaub für seine bedeutende Arbeit, seinen unermüdlichen Einsatz und auch die ausgezeichnete Zusammenarbeit herzlich bedanken. Und wir wünschen alles Gute für den Start in den neuen Lebensabschnitt.
Thank you very much, Austria. Now, Poland, following by Finland.
Thank you, Chair, President, Regional Director, Excellencies, colleagues. Poland fully aligns with the statement delivered by Spain on behalf of the European Union and its member states. Recent events have reminded us that disasters, conflict, disease outbreaks, and other health emergencies pose a constant threat and can devastating impacts. Those events are expected to become increasingly frequent, severe, and intertwined in the coming decades. The emergency medical team initiatives seeks to improve the timeline and quality of healthcare services provided by national and international EMTs, as well as to strengthen national healthcare systems' capacity to activate and coordinate rapid response. This shows us the need for professional support of teams following under the same rules, understanding the needs, and working together in unity and harmony. In Poland, so far, we have one certified emergency medical team, the Polish Center for International Aid, which, among others, manages the Medevac hub Jesionka near Rzeszów. In response to growing needs, the other three EMTs have started the process. Two NGOs, Humanos and Polish Medical Mission, and one governmental, humanitarian and medical emergency team. We support the EMT initiatives and the idea of regionalization, but we must bear in mind that the regional strategy should be universal and take into account the diversity of the legal system of the member states. Its task is to synchronize action toward a common goal. This idea has to be in line with its design. We would like also to refer to initiatives like the European Civil Protection and Humanitarian Aid. Supporting synergies between these two projects will increase efficiency of our help in emergency situations. Thank you.
Thank you very much, Poland. Now I give the floor to Finland, following by United Kingdom. Finland, the floor is yours.
Thank you, Chair. Finland aligns itself with the statement of the European Union and its member states delivered by Spain, and the Nordic-Baltic joint statement delivered by Norway. Finland is strongly committed to strengthening global health emergency preparedness and response. Preparedness to health threats starts in countries and communities. It is the responsibility of every government to ensure the resilience of their societies in emergencies. Increasingly, health emergency preparedness, response, and resilience are linked with the direct and indirect consequences of human actions on our climate. The related crises are multisectoral and rarely limited to a single nation, emphasizing the need for an enhanced common approach. This aligns with the aims for Preparedness 2.0. In many countries, diminishing number of health workforce poses an ongoing challenge to health systems. Safe and scalable care, one of the priority areas for Preparedness 2.0, is a critical component of the resilience of any health system. It is crucial that flexibility and the capability and capacity to reorganize healthcare resources in a crisis are considered a vitally important part of health security. Efforts aimed at enhancing health system resilience need to include actions that promote these components. Finally, health emergencies widely impact societies. It is crucial to strengthen a whole of government, whole of society approach. Our national model is based on a comprehensive security strategy for society, formed on the notion that vital societal functions are provided and secured by authorities, non-state actors, and citizens together. Thank you.
Thank you very much, Finland. Now I give the floor to United Kingdom, following by Netherlands. Please, you have the floor, UK.
Thank you, Chair. I will start by praising the WHO Euro Office for their work responding to the full range of health emergencies in the region, including the devastating impacts of conflict and of terrorism. We know conflict always has a terrible effect on population health, as we've seen in several situations, including in Nagorno-Karabakh, and we thank WHO for their work across many different conflicts and emergency situations. This includes, in Ukraine, Russia's ongoing illegal and unprovoked invasion of Ukraine continues to destroy health systems and cause grave health impacts to the people of Ukraine. And we thank Dr. Kluger and his team who've worked tirelessly to support the health of the population and the ongoing impact on healthcare facilities there. I'm a medical doctor by background, and as healthcare professionals, we recognise the ongoing impact that health has on health of conflict in our region and globally. The UK has been clear that we stand with Israel after the horrific terrorist attacks by Hamas and welcome the commitment to ensure routes into Gaza are opened for humanitarian aid to support ordinary Palestinians who face an acute humanitarian crisis. We welcome the opportunity to discuss Preparedness 2.0. We are pleased there's an all-hazards framing and with the inclusion of a One Health approach in the strategy. This is helpful. We think there could be a stronger emphasis on the multi-sectoral nature of many of the approaches that are needed. For example, more explicit consideration of the impact of extreme weather events and climate change. We note that Preparedness 2.0 will need to remain aligned with global work, including the Health Emergencies Preparedness and Response Strategy, the Pandemic Accord, and amendments to the international health regulations. We look forward to working with the Secretariat on collaborative health surveillance, as outlined in paragraphs 18 and 19, as we believe these will need to align with initiatives such as the Pan-European Disease Network and the Pandemic Accord negotiations and the outcome of the negotiation process. On regional EMTs, we're pleased to support this proposal and would welcome insight from the Secretariat on how you will work with other regions and relevant groupings. Finally, we echo Austria's thanks to Dr. Rockenschaub and thank all of the WHO European Office for their work across the breadth and complexity of emergencies in our region. This is not just enabling health systems to recover from COVID, but responding to other emerging infectious disease and variants, and the requirement to step up urgent responses to the impacts of climate change, extreme events, and of course, where I started, the devastating impacts of conflict and of terrorism. Thank you, Chair.
Thank you very much, United Kingdom. Now, I give the floor to the Netherlands, following by France. Netherlands, please, you have the floor.
Thank you, Chair. The Netherlands aligns itself with the statement made by Spain on behalf of the European Union and its member states. To start, the Netherlands is deeply worried about three major concerns in our region: the Russian war against Ukraine, as well as the conflicts in Nagorno-Karabakh and in Israel and Gaza. The Netherlands urges parties to respect international humanitarian law and emphasizes the right to protection of UN staff, facilities, goods and infrastructure that serve to provide humanitarian aid, including medical assistance. We thank WHO Euro staff in their support of those most in need in the conflicts just mentioned, but also in the earthquake in Turkey and Syria this year. We welcome the work of the Secretariat on this important topic, to be able to meet the challenges in offering emergency services with speed and agility. The reports under this agenda item show ambition and a comprehensive approach to the emergency prevention, preparedness and response. We particularly welcome the whole of government, whole of society, cross-sectoral approach and a specific focus on One Health and surveillance. We really appreciate the resolve to include all relevant stakeholders, including the quadripartite on that topic. Like others, like Belgium and UK, we hope future predictable events will be taken in scope, like climate change. In a similar vein, we want to stress the impact of an emergency situation on mental health and the need, therefore, to continue developing the program for mental health and psychosocial support. On that front, the challenge will be to be able to ensure continuation of this care, because even if the emergency phase is over, mental health problems can remain or even arise only in the aftermath. We thank the Secretariat for including prevention and preparedness of sexual exploitation and abuse and harassment in their scope. And as we note that the discussions on health emergency prevention, preparedness and response are ongoing in Geneva, in different tracks and in different pace, we trust the WHO Euro Secretariat will keep an ear close to the ground while developing this important strategy. And we look forward to discussing the progress at the next meeting in 1 year's time. Thank you, Chair.
Thank you very much. And now I give the floor to the France, following by Turkey. France, you have the floor.
Merci, Monsieur le Président, Monsieur le Directeur régional. Tout d'abord, je suis ravi d'annoncer la volonté de la France de se joindre à la déclaration sur le personnel de santé et les partenariats médicaux internationaux initiée par l'Ukraine lors du sommet des Premières Dames et Messieurs le 6 septembre dernier à Kiev. La France est engagée aux côtés de l'Ukraine et de son peuple, y compris en soutenant la coopération entre les institutions médicales ukrainiennes et françaises. Cette coopération interhospitalière contribue aussi à la préparation, riposte et résilience face aux urgences sanitaires dans la région. La France s'associe pleinement à la déclaration prononcée par l'Espagne au nom de l'Union européenne et de ses États membres et se rallie aussi à la déclaration prononcée par la Croatie sur la résolution à venir sur la résilience face aux catastrophes naturelles et leur souhaite succès dans les négociations à venir. La France félicite la région Euro pour cette initiative régionale sur la préparation, la riposte et la résilience face aux urgences sanitaires et salue la coordination étroite qu'elle appelle entre l'OMS Euro, l'Union européenne, les États membres en la matière. Il sera pertinent pour la stratégie pan-européenne de préparation 2.0 de tirer parti du travail entrepris au niveau régional, y compris par une collaboration étroite avec l'Union européenne et ses agences, en particulier la European CDC, dont le rôle peut être bénéfique à toute la région pan-européenne et au-delà. Nous souhaitons également pleinement l'approche visant à renforcer les systèmes de santé afin de garantir le maintien des services de santé essentiels tout en gérant efficacement les urgences sanitaires. La stratégie de la région Europe doit viser à renforcer les relations avec les institutions clés de l'OMS dans la région, telles que le Bureau OMS de Lyon pour la sécurité sanitaire, l'Académie de l'OMS à Lyon en la matière et de formation, et puis le hub ouvert pour l'information pandémique et épidémique situé à Berlin. La stratégie doit également aborder des priorités clés telles que la collaboration transfrontalière, les technologies de santé numérique, l'approche One Health et plus largement l'impact sanitaire du changement climatique, qui sont également des priorités partagées par l'Union européenne. En ce qui concerne le réseau pan-européen de contrôle des maladies, le renforcement de la surveillance collaborative devrait être sa première priorité. Je vous remercie.
Thank you very much, France. Now I would like to invite Turkey, following by Luxembourg. Please, Turkey, you have the floor.
Thank you, Chair. We have left behind a drastic pandemic period. Following this, unfortunately, a tragic earthquake occurred in my country. These subsequent processes have made us experience that the international concepts are vital, but not enough. On the other hand, it is clear that only practices will not keep us ready without the concepts. It is significant to build the future, including Preparedness 2.0, on a balance to be created between these two main pillars. In this context, I think the Preparedness 2.0 initiative will be an umbrella for the activities developed and carried out in this field so far, especially the priority areas such as governance and leadership, community protection, emergency coordinations are vital for health emergency management and regional health security. On the other hand, to build a strengthening European health emergency corps, gathering all initiatives and partnerships under one roof and EMT regionalization have immense importance. In this way, the response to health emergencies on the field will be standardized and its efficiency will be increased. In this sense, to contribute to the regional capacity, we have agreed with WHO to establish EMT Capability Hub in Istanbul. Distinguished colleagues, national action plans integrated with global trends and shaped in line with country priorities contribute greatly to global health security. In every health emergencies, we are only as strong as our weakest link. Making joint preparation for common threats and carrying out activities with this principle will prepare us for a much safer future. Mr. Chair, before conclude, I would like to share my personal experiences with the committee. I was on the field during the response to the earthquake occurred in my country from the beginning. It was one of the biggest in the century. I have coordinated emergency medical teams deployed to my country with the WHO teams. It was the biggest deployment in the history of this organization. Mr. Gerald and his team was with me on the field. I would like to take this opportunity to thank all WHO team with this opportunity. I have experienced the importance and we have experienced the importance and vital role of the EMTs together. But we have also observed the gaps and the areas that should be improved. Our region needs more coordinated and more capable EMTs for our communities. With its potential, our region can be a leading one within the WHO regions. So we invite member states and encourage Secretariat to support dedicated and devoted health professionals on the field, EMTs, during the consultation process. I thank you.
Thank you very much, Turkey. Now I would like to give the floor to Luxembourg, followed by Germany.
Monsieur le Président exécutif, chers délégués, le Luxembourg s'associe pleinement à la déclaration prononcée par l'Espagne au nom de l'Union européenne. Le Luxembourg salue les différentes initiatives en cours dans le cadre de la préparation aux pandémies et aux crises sanitaires en général, dans le développement d'une nouvelle stratégie Preparedness 2.0, ainsi que les projets concrets de mise en œuvre au niveau international, visant à l'amélioration du volet de la préparation aux crises sanitaires dans le UHPR, Universal Health Preparedness Review, qui vise à apporter des résultats concrets au niveau des pays participants et au-delà. Nous sommes fiers de partager que le Luxembourg prend officiellement part dans la phase pilote UHPR et rejoint les pays qui sont déjà engagés, dont le Portugal pour la région euro. L'UHPR a pour objectif de renforcer la capacité des pays à se préparer aux urgences sanitaires en engageant les autorités nationales au plus haut niveau. Et nous voyons dans cette approche une excellente opportunité de renforcer les travaux actuellement menés au niveau national, mais également au niveau européen et international. Cette initiative nous permettra également de renforcer les échanges et discussions intersectorielles nationales et d'engager encore plus les échanges régionaux et internationaux auxquels le Luxembourg est particulièrement attaché. Ces discussions et partages d'expertise et d'expérience amèneront finalement un renforcement des capacités de préparation et de réponse de tous les États membres. Particulièrement engagé dans cette phase pilote, le Luxembourg participera à la première phase de revue en faisant partie du panel de 3 États membres en charge de la coordination de la revue du Portugal. Le Luxembourg se réjouit de cette excellente opportunité de renforcer les liens et la coopération avec les États membres et de contribuer à l'amélioration du processus au niveau global. Nous encourageons d'autres États membres à s'intéresser à cette initiative basée sur la coopération, le dialogue et les échanges respectueux et constructifs entre États. Dans ce contexte, le Luxembourg se tient à la disposition des États membres qui le souhaiteraient pour présenter plus en profondeur notre expérience de participation à ce processus extrêmement intéressant. Je vous remercie de votre attention.
Thank you very much, Luxembourg. Now I give the floor to Germany, following by Switzerland. Please, Germany, you have the floor.
Sehr geehrter Herr Vorsitzender, sehr geehrte Damen und Herren! Deutschland schließt sich dem durch Spanien vorgetragenen Statement der EU vollumfänglich an. Außerdem schließen wir uns dem Statement von Kroatien zur Einbringung einer Resolution zu Umweltkatastrophen an. Covid-19 und andere Krisen in der Euroregion unterstreichen leider immer wieder die Wichtigkeit des WHO-Notfallprogramms. Ich möchte mich ausdrücklich bei WHO Euro für die hervorragende Arbeit im Bereich Vorsorge sowie Reaktions- und Widerstandsfähigkeit bei gesundheitlichen Notlagen bedanken. Das umfasst die Arbeit in Krisen wie Covid-19, dem Erdbeben in der Türkei und dem Angriffskrieg Russlands in der Ukraine, neben vielen anderen. Deutschland begrüßt ausdrücklich, dass WHO Euro die Vorsorge 2.0 entwickelt hat. Bei gesundheitlichen Notlagen nimmt das Gesundheitsfachpersonal eine besondere Rolle ein. Ausgebildetes, gut ausgestattetes sowie lokal einsatzfähiges Fachpersonal ist die Basis für eine erfolgreiche Vorsorge und Bekämpfung von Gesundheitskrisen. Ich freue mich zu sehen, dass die medizinischen Notfallteams, die Emergency Medical Teams im Strategie- und Aktionsplan präsent erwähnt werden. Deutschland und insbesondere hierbei das Nationale Public Health Institute, das RKI, nimmt eine sehr aktive, unterstützende Rolle bei der Ausarbeitung des Aktionsplans zur Stärkung der EMT-Initiative ein. Ich möchte außerdem positiv erwähnen, dass das Global Outbreak and Alert Netzwerk und die Initiative der mobilen Labore als wichtige Unterstützungselemente enthalten sind. Beides sind Bereiche, in welchen wir eng mit Fachinstituten wie dem RKI gut und eng mit der WHO zusammenarbeiten. Bei den strategischen Prioritäten möchte ich 3 Punkte hervorheben. Erstens, kooperative und integrierte Surveillance. Wir setzen uns seit unserer G7-Präsidentschaft stark für kooperative Surveillance ein. Gestärkte Surveillance, Mechanismen und Modalitäten sowie ein verbesserter Austausch von Daten und Erregern aus dem Human-, Veterinär- und Umweltbereich spielen eine wichtige Rolle. Zweitens, der im Papier genannte Schutz von Gemeinschaften, beispielsweise im Sinne einer transparenten und in der Situation angepassten Risikokommunikation. Ich bin überzeugt, dass dies eine Voraussetzung für den Erfolg etwaiger Maßnahmen darstellt. Dies hat uns die Covid-19-Pandemie deutlich gelehrt. Drittens, eine sichere, bedarfsgerechte und qualitativ hochwertige klinische Versorgung einschließlich des Zugangs zu medizinischen Gegenmaßnahmen. Deutschland setzt sich daher auch bei den Verhandlungen zum internationalen Pandemieabkommen für einen rechtzeitigen und gerechten Zugang zu medizinischen Gegenmaßnahmen ein. Herzlichen Dank.
Thank you very much, Germany. Now I would like to invite Switzerland, following by Kazakhstan. Switzerland, the floor is yours.
Merci, Monsieur le Président, Monsieur le Directeur régional, Mesdames et Messieurs. La délégation suisse remercie le secrétariat pour le travail accompli par la région européenne en matière de préparation, de réaction et de résilience aux situations d'urgence sanitaire. La pandémie de Covid-19 et les urgences sanitaires alarmantes en cours dans la région nous montrent que nous ne sommes pas suffisamment préparés à ce jour. C'est pourquoi nous suivons de près le processus d'élaboration de la nouvelle stratégie et du plan d'action préparation 2.0. Tout d'abord, au regard des négociations en cours au sein de l'organe intergouvernemental de négociation et des amendements au règlement sanitaire international, nous saluons l'effort du groupe consultatif technique d'aligner préparation 2.0 sur les 2 processus et d'éviter les doublons. Nous estimons qu'il est extrêmement important que les processus régionaux ne préjugent pas du résultat des discussions qui sont toujours en cours à Genève. La Suisse participe activement à ces 2 processus dans le but de renforcer l'architecture mondiale de la santé. Deuxièmement, nous sommes d'accord avec la recommandation du groupe consultatif technique selon laquelle l'approche Une seule santé doit être intégrée à tous les niveaux de la prévention, détection et réponse aux urgences sanitaires à l'échelle mondiale et dans la région. Une mise en œuvre complète de l'approche Une seule santé pour assurer la préparation et la réponse régionale devrait impliquer le renforcement des plateformes de surveillance et la consolidation des partenariats multisectoriels dans les domaines de la santé humaine, animale et environnementale. Troisièmement, la Suisse soutient l'initiative mondiale des équipes médicales d'urgence, EMT. Nous saluons les changements stratégiques et l'expansion qui ont permis de passer d'un déploiement international à la mise en place nationale, ainsi qu'à la planification et la coordination des opérations de pointe. Cela est important pour renforcer la résilience des systèmes de santé et des effectifs nationaux et d'assurer leur pérennité. Dans le même ordre d'idées, la Suisse soutient la proposition d'élaborer un plan d'action régional visant à renforcer l'initiative EMT dans la région. Pour conclure, nous nous réjouissons du processus de consultation de la préparation 2.0, comme annoncé dans le rapport du groupe consultatif technique, afin de recueillir le retour des États membres. La Suisse reste engagée dans le renforcement de la préparation, de la réponse et de la résilience aux urgences sanitaires au niveau mondial et régional. Je vous remercie.
Thank you very much, Switzerland. Now I would like to give the floor to Kazakhstan, following by Israel. Please, Kazakhstan, you have the floor.
Большое спасибо, уважаемый председатель, уважаемый региональный директор. Обеспечение готовности и своевременного реагирования на чрезвычайные ситуации в области общественного здравоохранения является приоритетным вопросом в Казахстане. Казахстан поддерживает разработку стратегии обеспечения готовности 2.0, которая будет отвечать принципам архитектуры обеспечения готовности, реагирования и повышения устойчивости к ЧС в области здравоохранения и будет включать в себя надлежащее стратегическое руководство, эффективные системы и обеспечение финансовой устойчивости на основе принципа учета всех факторов риска и концепции здоровой нации. Единой нации здоровья. В Казахстане реализуется дорожная карта по реализации международных медико-санитарных правил на 19-23 годы, которая содержит 15 приоритетных направлений. В настоящий момент проводится актуализация дорожной карты с учетом всех международных рекомендаций. Важным аспектом реагирования на чрезвычайные ситуации здравоохранения является эффективная координация действий между различными секторами. Руководящая роль в координации ЧС в здравоохранении отводится Министерству здравоохранения. При необходимости вовлекаются другие заинтересованные органы, в том числе международные организации. Цифровизация, как было отмечено в докладе, является одним из важных элементов реагирования на чрезвычайные ситуации. Возможность цифровизации наглядно была продемонстрирована в период пандемии COVID-19. В Казахстане осуществляется цифровизация различных процессов, связанных со здравоохранением. Реализованные мероприятия направлены на цифровые и автоматизацию процессов. Отечественными специалистами разработаны и внедрены масштабные проекты, что позволило улучшить реагирование и повысить эффективность системы обеспечения готовности. В рамках реализации дорожной карты по ММСП в январе 2019 году при поддержке Всемирной организации здравоохранения и CDC создан оперативный центр по чрезвычайной ситуации в общественном здравоохранении. Оперативный центр сыграл важную роль в реагировании на пандемию COVID-19 и на межведомственное взаимодействие в этот период. Казахстан продолжает реализацию мероприятий, направленных на укрепление системы реагирования на ЧС в общественном здравоохранении. Спасибо за внимание.
Thank you very much, Kazakhstan. Now I would like to give the floor to Israel, following by Slovenia. Israel, you have the floor.
Thank you, Mr. Chair. The health system in Israel is constantly prepared for 11 types of threats, including emergencies, mass emergencies, and war. The ministry prepares in coordination with the Home Front Command, rescue organizations such as MDA, the National Society for Red Cross, and private ambulance services. The preparation model brings the light to the system's strength through central management and management for all health resources and national resources. Even in a large and significant catastrophe in which the State of Israel will be required to use the EMTs, management will be central through the strategy for the maximum utilization of resources. Unfortunately, on the terrible events on October 7th, when Hamas terrorists raided dozens of towns in the State of Israel, murdering, wounding, and taking captive of old men, women, and children, all of this preparation was not enough. For hours, the rescue team could not reach the injured. Even the red box, there is no reference of a murderous events in such magnitude in which the rescue team are attacked and murdered while trying to save the lives of the wounded. The EMT strategy shows a need for strengthened national focal point in order for the medical response to be provided as orderly as possible with the proper standards, preventing the arrival of medical rescue team to treat the wounded, and shooting the medical rescue team prevents the provision of any medical response and any standard. The massacre happened over 2 weeks ago, and despite this, no official outreach has been extended to ask if the State of Israel is required any assistance from the EMT Secretariat. When the EMT Secretariat requested assistance on behalf of Armenia, within hours, teams and equipment were made available. Indeed, Israel was among the first to respond, with the understanding that medical assistance is above all politics. Throughout history, Israel has experienced multiple mass casualties events and has built well-organized response models. We understand the importance of sharing our experience and training with other member states and to provide assistance when called upon. I thank you.
Thank you very much, Israel. Now I would like to give the floor to Slovenia, following by Slovakia.
Thank you,
Please.
Chair. Slovenia aligns itself with a statement made by Spain on behalf of the EU, and please allow me to make some additional short remarks in our national capacity. Dear Regional Director, thank you and your team for the tireless efforts in responding to the emergencies in our region, which stem from different sources, from infectious disease outbreaks, natural disasters, to conflicts. An important aspect of responding to emergencies is not only to respond to the acute crisis, but to adopt a dual-track approach, which also includes a continuous strengthening of the health system, with a focus on primary care. A strong health infrastructure is an important factor for social cohesion and economic prosperity. Therefore, we must invest in improving it, also while responding to viruses, earthquakes, or even armed conflicts. We must not forget about the continued care for people living with chronic conditions, as well as prevention and health promotion. For example, it is critically important to support and protect women who want to breastfeed, a practice that provides food, nurturing care, immune support, and is a lifeline in emergencies. We need to think of how to better support such measures, as they importantly contribute to the resilience of our systems and people when it counts the most. Thank you.
Thank you very much, Slovenia. And now I would like to give the floor to Slovakia.
Thank you, Chair. Regional Director, Excellency, Slovakia aligns itself with the statement of Spain made on the behalf of the EU and its member states, and also with the statement made by Croatia on this agenda item. Slovakia welcomes the WHO regional office work and also priorities set of this area and presented action plan. We would like also to highlight the importance of One Health approach, drawing special attention to biological risks and hazards linked to biosafety and biosecurity as integral parts of the health security framework and defining the regional implementation of global health emergency infrastructure and architecture. Alongside these, we would like to highlight also contextualization needs in the regional specific needs, reflecting different stages of the development and also challenges on the sub-regional level as it is identified. We would like to emphasize that the partnership among the state institutions, academia, patients, health-driven organization, professional and civil actors, organizations is essential for impactful change and also effective implementation in the process of national development, humanitarian teams and EMTs accreditation as well. Closer collaboration and flexible agreements throughout allocation of the resources through the country's offices. It is also solid basis for the effective implementation, including EMT evaluations. Finally, we would like to thank the regional office for this document and also ask for introducing educational programs into the framework's implementation in cooperation with experts and WHO collaborative centers. It is also crucial to issue progress report regularly with the strong focus on the areas with difficult implementation, such as matters of sufficient of EMT national and regional teams or experts education in the field of humanitarian resource management and crisis management in the emergencies and humanitarian conditions. We strongly encourage member states to continue to work on valuable resolution on biohazard and natural disasters, and we would like also to invite interested member states to join us in the initiative of update of the 2005 biosafety and biosecurity on laboratories and biocontainment resolution. Both those initiatives in this field have and should have strong regional aspects. Thank you.
Thank you very much, Slovakia. As there are no more member states asking for the floor, I would like to give the floor to the partners. So please raise your nameplate if you wish to speak. Yes, I see IFRC. You have the floor.
Thank you, Chair. The IFRC Regional Office for Europe commends the decision to develop a regional action plan for emergency medical teams. We especially appreciate the emphasis on localization and digitalization of the EMT, domains where the Red Cross and Red Crescent societies and the IFRC have substantial expertise. We stand ready to foster a synergistic collaboration in these areas. The IFRC, with its membership, has been a provider of global, regional, and national emergency medical teams since its birth over 100 years ago. in a standardized and modularized form called emergency response units. Red Cross and Red Crescent teams have provided international emergency medical support since the mid-90s. The IFRC is a founding member and a keen supporter of the EMT initiative of the WHO since the first PAHO-led meeting in 2010. A significant milestone in the WHO-IFRC relationship was reached when Dr. Tedros and the IFRC Secretary General Jagan Chapagain signed an MOU, the so-called Red Channel Agreement, establishing the division of labor and responsibilities in validating, quality assuring, mobilizing, and evaluating the emergency medical teams of the Red Cross and Red Crescent. It's essential to bring the intentions and principles of this global agreement to the regional action plan. The national Red Cross and Red Crescent societies have a particular position in their countries as auxiliaries to the public authorities. Their involvement can significantly enhance the emergency medical response capabilities of WHO Euro member states. The IFRC offers its partnership to the WHO Euro to support the regional strategy and to help engage the Red Cross and Red Crescent membership in the Europe region in the EMT initiative in a manner that efficiently supports the member states' emergency preparedness and response readiness, while ensuring our adherence to our fundamental principles of independence and impartiality, contributing to principled humanitarian action. On Preparedness 2.0, we particularly welcome the focus on a risk-based, all-of-society and all-hazards approach, co-designed with communities. As the Federation of Community-Based National Red Cross and Red Crescent Societies, we particularly emphasize the communities as active players in shaping a successful preparedness, readiness, response, and resilience strategy, as well as the role of community-based organizations in advocating for them. Embracing trust, equity, and local action will enable a society to handle future disease outbreaks and other hazards better. The IFRC Regional Office for Europe is dedicated to supporting the road to Preparedness 2.0. Our organization and its extensive network represent a robust platform with coordination capabilities and technical expertise. We are committed to fostering active collaboration between the IFRC and WHO, as well as the member states and our membership. I thank you.
Thank you very much, Red Cross. I don't see any other partners who would like to take the floor at this moment. And now we will switch to our non-state actors. And the Secretariat has received a request to take the floor from the European Federation of Allergy and Airways Diseases Patients Association and the European Network for Smoking and Tobacco Prevention. So this statement will be read by Mr. Panagiotis. So please, Mr. Panagiotis, you have the floor.
Thanks a lot, Chair. On behalf of the European Federation of Allergy and Airways Diseases Patients Associations and the European Network for Smoking Prevention and Control, I would like to welcome the Preparedness 2.0 strategy for the WHO European region. The lung health community of medical societies, patient associations, and public health organizations can have a key role to making this strategy a reality, contributing in many, many different ways. For example, through surveillance by supporting monitoring and detection, the development of early warning systems, but also integrating respiratory data into surveillance systems. Secondly, through risk assessment and preparedness, by co-creating preparedness strategies to address respiratory pathogens, chemical and biological threats tailored to patient needs. Through care and treatment, as lung experts can help design appropriate care pathways, including for palliative care. Through training for health workforce, which can enhance workers' skills in managing respiratory emergencies in patients with chronic diseases during acute events. Through community education, as civil society can contribute to community engagement, risk communication, and tackling the infodemic. And finally, by helping shaping national vaccination strategies, as lung health organizations can contribute to vaccine confidence in infectious respiratory diseases such as influenza, COVID-19, respiratory syncytial virus, and pneumonia. To summarize, the lung health community can have a crucial contribution in improving preparedness in the region, ensuring a cohesive approach to health emergencies. We as NSAs are looking forward to offering our input to this consultation process. Please note that these points have also the full support of the European Respiratory Society, who unfortunately could not attend this meeting. Thank you very much.
Thank you very much. The Secretariat also received 5 written statements from different organizations. And let me remind you to consult these written statements, which was submitted by member states, non-state actors, and international partners on a website of the regional committee. So by this, I would like to invite and give the floor to Dr. Rockenshaupt to make and provide any responses. So, Gerald, the floor is yours.
Thank you very much, Chair. Let me start with saying a big thank you for the rich and valuable comments and for the many supportive and encouraging statements. Without necessarily going to each and every point, I see some common themes in some of you articulating the need for a very strong alignment with the ongoing global processes. Let me assure you there is every intention to see this as a mutually corroborating and reinforcing parallel processes, and that we will put every effort to make sure that we don't jump the line and go ahead of the negotiations happening at the global level, while also using the opportunity of the Preparedness 2.0 process to ensure that member states in the European region remain closely engaged in the global negotiations, but also keep adequately informed of recent developments. And for that we have created a special information platform at the regional level that provides regular updates on the progress in the ongoing global processes. Another highlight I would just briefly want to emphasize, if you allow me, is that non-communicable diseases and emergencies play a major role in the challenges that we face, both in conflicts and natural disasters. And hence we work very closely with our non-communicable disease team and with our health systems colleagues. We had a regional consultation on that, and we will in Copenhagen in February host a global conference on non-communicable diseases and emergencies, and the outcomes would obviously feed into the Preparedness 2.0 process. We also hear you loud and clear on the importance that climate change needs to play. Obviously, we see this very strongly embedded into the all hazards approach that we intend to embark. Eventually the One Health approach is also a key priority that we intend to strongly reflect. We see that we need to have a synergistic process, that we need to work very closely with EU institutions, that we need to avoid duplication. I look very much forward to a productive journey that would lead us eventually to a new strategy and action plan for health security that creates a more resilient European region. Maybe a final point to the Honorable Delegate of Israel, if you allow me. The regional office stands ready to mobilize any potential support that might be needed by the State of Israel. We are at your disposal. In fact, at the very early stages on 8th of October, we had a direct exchange with the Ministry of Health offering support, and were at that stage told that we should put it on hold. But if the situation has changed, we are at any stage ready to work with you very closely to provide the necessary support. Thank you very much.
Thank you very much, Gerald, for your replies. And now I would like to invite distinguished Regional Director, Dr. Hans Kluge. Please, Dr. Hans.
Thank you, Executive President. First and foremost, I would like to convey my condolences to all people, all families, all children all healthcare workers who passed away or suffered due to man-made or natural disasters. When I became the regional director 3 years ago, there was no any crisis of global impact. Since then, we have seen 4. This is a completely different WHO European region. But our mandate remains to promote and to protect health of everyone, everywhere. Health for all. For us, health is not political. We try to be very agile and fast, but considered, always, of course, taking into account the leadership of the countries involved. I went quite quickly with Dr. Tedros to Turkey, and I would like to commend Dr. Fahrettin Koca, Minister of Health. I was very impressed. Minister actually was living in, how should I say, in the place next to the earthquake, together with all the volunteers working day and night, and we went together to the affected areas. As I mentioned, every 4 months, I also go myself with Dr. Viktor Lashko to Ukraine, and will continue to do as long as it is needed. The one thing I regret is that for more than 1 year, I have been asking to the parties to get humanitarian access to Mariupol and to Donbas, but we have not received yet. This humanitarian corridor is there for Zaporizhia. So then I'm sometimes thinking, why is it there for the nuclear plant, but not for the health facilities in Donbas and Mariupol, if all of us are committed to health for all? As Dr. Gerald Robinshop was mentioning, indeed, very fast also we offered our support to Israel, and we stand ready, again, recognizing, of course, a very strong health system in the country. And also, as was recognized by several of you, including Spain, thank you very much, and also France, I had sent very fast my special envoy, Mr. Rob Butler, who would like to comment to Armenia, and I then followed up myself with a mission to Yerevan, Tbilisi, and Baku. I would like to reassure you that we're very careful to synergize with the global processes, so we're very well aware of that one, and this remains very, very important. And then finally, I would like to thank Dr. Gail Carlson, the chair of the Technical Advisory Group. Thank you very much, Gail. I participated at the meeting myself, and then also Gino Klaas from the EMT, on behalf of the EMTs. I have seen the EMTs in action in Turkey, then also in Yerevan, also the Israeli EMT, who had sent plastic surgeons for the victims of the people of the tragic explosion at the gas station, and I have seen the really life-saving and humanitarian effect of this emergency medical team. So I'm very grateful for your support to this initiative and to the support of Turkey for our GDO on emergency preparedness in Istanbul. This is a very, very strong resource. Dr. Yusuf, please convey my appreciation, because it gives us the human resources and the financial resources to scale up our activities. I want to thank also here Dr. Mike Ryan and Dr. Chikwi from WHO headquarters, and I'm asking Professor Jeremy Ferrar to convey my appreciation, because this is a very, very good example of working the 3 levels of the organization. This will be detrimental if we all work independently, but there is a very well established mechanism in WHE, the emergency program globally, to work across those 3 levels, which actually now is also working for the war in Israel and Palestine. I myself, I am almost in daily contact with Dr. Ahmed Al-Mandari of the Eastern Mediterranean region to see whatever we can support Dr. Ahmed if he's asking. Because again, I want to reinforce that we promote and protect the health of everyone, everywhere. Finally, I would like to thank my own, what I call, A-team of WHE, and thank you to Austria for having mentioned yesterday the importance of the health and mental health on staff, because this team, under the very able leadership of our regional emergency director, Gerald Rockenschop, has been working incredibly hard, I think non-stop for the last 3 years. And we have represented here Katie, Ihor, and Oleg, but please thank all of your colleagues for literally working 24/7 with a very big heart. And finally, to thank Gerald, who you wouldn't say if you look at how young Gerald looks, but he comes to his retirement end of this month. I tried to convince him to stay a bit longer, but I could convince him, but not his spouse, which I think is also important, because when the family says it's enough, it means that probably it's enough, Gerald. It will not be easy. You have been a pillar for us, steering us through the most turbulent times, but with a very, very steady, quiet, and wise hand. To your last assignment, you have brought decades of experiences in WHO and other agencies, rooted in your strong dedication to be particularly in the field with the people. Gerald was always in the field with the people. Lieber Gerald, ich danke dir für deinen herausragenden Einsatz und wünsche dir für deinen nächsten Lebensabschnitt alles Gute. Dankeschön.
Thank you very much, Dr. Hans, for your strong commitment to the principle health for all, and for your constant support in any emergency situations. So it seems like, in line with the Kaizen technologies, you're implementing the managing by walking around technology. As we know that you and your team brave enough not to hide and sit in the office and go to the front line wherever the emergency is. Thank you very much once again for your constant support. And thank you very much, Dr. Rockenschop, Dr. Gerald, for keep us updating during the year when I was serving as the chair of the standing committee. So you were sharing the valuable and information and recommendations to member states in all about the emergencies. So yeah, it seems like now we are about to close that item of our agenda. And of course, we are looking forward for these important developments. And thank you very much, Member States, for your valuable comments. And I will assure you that the notes will be taken by the Secretariat. So with this, then I close this agenda item. And let me move to the next agenda item.